So in this image here, we have a rotator cuff tear. This is at the supraspinatus at the top of the shoulder, and this is a full thickness tear of the supraspinatus outlined here. This is where the tendon normally should attach on the ball side of the shoulder here. This is a side view of the rotator cuff here. This is also a tear of the supraspinatus tendon. The tear is outlined here. Once again, you can see the long head of the bicep intimately associated with the rotator cuff tendon. So rotator cuff tears, this is a very common cause of pain and disability. It affects about 2 million people in the United States annually. So how do we diagnose it? Starting out by a history in the office, a physical exam, and then imaging. So history, rotator cuff tears definitely occur more often in a person's dominant arm. They're more commonly found among people over the age of 40. It's not uncommon for folks to have pain that's worse at night and interferes with sleep. Folks also have difficulty lifting things, particularly overhead and rotating the arm. Folks also have difficulty performing activities of daily living, like combing their hair or getting dressed. I would say the most important risk factor with regards to rotator cuff tears, unfortunately, is age. Greater than 40% of patients over the age of 65 have a rotator cuff tear of some sort. Other risk factors are overhead activities. Folks like painters, carpenters who do a lot of overhead work do have a higher incidence of rotator cuff tears. Folks who play overhead sports, particularly at a competitive level, like baseball pitchers and tennis players, also have a higher rate of rotator cuff tears. Physical exam. For the most part, folks who have rotator cuff tears have weakness with forward elevation, which is this action in the left image here. They have weakness raising their arm above their head, or external rotation, which is pictured here on the image on the right, turning your arms out. MRI is great at diagnosing rotator cuff tears. On this MRI here, this is the supraspinatus tendon, and you're supposed to have a nice black tendon coming all the way out to the edge of the shoulder here. And in this picture, you don't. You have a full thickness tear, which is this white spot here on the MRI. So types of rotator cuff tears. There's two types: acute traumatic rotator cuff tears and chronic. So acute tears are characterized by an injury of some sort, such as lifting something heavy, falling, or after a shoulder dislocation. It's typically seen in older patients, although it can be seen in patients younger than 30 years of age. This is usually associated with a significant injury like a motorcycle accident or a fall from greater than 10 feet. Degenerative tears. These are tears that occur gradually in the tendon over years through repetitive stress to the tendon itself, or from bone spurs on the undersurface of the shoulder rubbing against the rotator cuff tendon. This is a picture in an animation of a bone spur. This is the roof of the shoulder called the acromion, which is part of your shoulder blade. And here you can see a bone spur on the undersurface. This bone spur, as you can see, if one were to lift their arm, can rub against the underlying rotator cuff and cause either a partial or full thickness rotator cuff tear. So full thickness versus partial thickness tears. What I mean by a full thickness tear outlined here on the right is that the tendon is torn through the entire substance of the tendon, full thickness. And on the image here, we have a partial thickness tear. The tendon is torn, but not through the entire thickness of the tendon. So full thickness tears definitely progress more quickly as far as size goes. And partial thickness tears are usually more stable and progress more slowly and are typically safer to be treated without surgery. So this is something important I'd like to talk about with regards to rotator cuff tears. Unfortunately, and I get this question all the time, once a rotator cuff tendon is torn, for the most part, it is torn. It does not heal, unfortunately. The reason being rotator cuff tendons, where they typically tear, is where there's poor blood supply in the shoulder, and without blood supply, tendons, bones, they can't heal. So this tear, like a tear in fabric in the rotator cuff, will only get bigger with time. So non-surgical treatment options for rotator cuff tears. Activity modification. What I mean by that is avoiding overhead lifting or heavy lifting. You can try anti-inflammatory medications like ibuprofen or Aleve. Cortisone injections, some doctors do inject people with rotator cuff tears with cortisone. It's a bit controversial. It's not my preferred method of treatment, but some doctors do that. Physical therapy, it's important to note, physical therapy does not fix the tear, but in some people, it can make them feel better by strengthening the other rotator cuff tendons that are not torn. So these are some exercises I give folks in the office. These are very basic rotator cuff strengthening exercises that can be done with bands in a doorway, with a doorknob to strengthen the rotator cuff tendons. This is a picture of other types of bands that can be used to strengthen the shoulder. And here's a picture of a patient doing external rotation exercises to strengthen their posterior rotator cuff. So surgical treatment. Who gets surgical treatment? Full thickness and partial thickness rotator cuff tears that fail to respond to non-surgical treatment like therapy, medication, rest. Also very important to note, all acute traumatic rotator cuff tears, particularly in folks under the age of 60, should be treated operatively. The reason being is the tendon was attached one day and then through trauma, the next day it's not. And these folks do not respond well to non-operative treatment. It's also important to know, in order to qualify for surgery, as far as your rotator cuff tendons go, you need to have good muscle and tendon on the MRI. Folks who do come to me oftentimes have very large rotator cuff tears, and sometimes the tendon quality is not good, and there's significant atrophy, and unfortunately, these cannot be fixed. Shoulder arthroscopy. This is the mainstay of operative treatment of shoulder rotator cuff tears. This is an outpatient surgery, also known as same-day surgery, where the rotator cuff tendon is fixed through small incisions in the shoulder using specialized instruments and cameras. A nerve block is administered by the anesthesiologist on the day of surgery, which helps control a lot of the pain in the first 24 hours of surgery. So this is a picture of the type of portals, incisions, small arthroscopic incisions that we make during shoulder surgery. One is typically made on the front, another on the side, another on the back. Sometimes, depending on the complexity of surgery, you do need to add extra portal incisions. This is an animation of shoulder arthroscopy. It involves a camera to see what you're doing in the shoulder and take pictures. An arthroscopic pump, which actually fills the shoulder with fluid so that you can see. And then motorized instruments to perform the surgery. This is another animation of an arthroscopic shoulder surgery. This is a pump used to fill the shoulder. This is a camera here to see inside. And this is an instrument used to repair the torn tendon here. This is an intra-op picture of a shoulder arthroscopy. This is a camera here, and the camera actually has a pump attached to it. That's what this fluid line is that inflates the shoulder so you can see. And here is a motorized shaver that is used during surgery. This is an intraoperative photo of a full thickness supraspinatus rotator cuff tear. This is a U-shaped tear of the rotator cuff tendon here. This is the tear outlined here. And this tendon is supposed to be all the way over here on the greater tuberosity. This is the point where the rotator cuff tendon attaches on the humerus bone. As you can see here, sutures have been placed in the tendon to anchor it to the bone. This is an animation of the anchor and suture placed in a torn rotator cuff used to repair the tendon down to the bone. Here's a picture of the finished product showing the tendon being passed through the bone and an anchor pushing the tendon back down in the bone so it can heal. This is an intra-op picture of a rotator cuff repair surgery. These sutures have been used to fix the tendon back down to the bone. So it's important to talk about biceps tears. These are frequently seen during surgery. And when I mean biceps, I mean the long head of the biceps that actually anchors at the top of the shoulder and travels at the front of the shoulder. These tears are frequently seen during surgery and need to be addressed. I use a biceps tenodesis procedure where the biceps is re-anchored in the armpit with an incision about 1 inch. Here's a picture of the long head of the biceps. As you can see, it travels down the front of the shoulder and originates in the joint of the shoulder here. Here's a picture of a biceps tenodesis. This is where the long head of the biceps typically tears and is seen during surgery. And this segment here is removed and the biceps is re-anchored right here I use a small metallic button, which is titanium. It's no bigger than a piece of rice. And the tendon is sutured in a manner like this and tied down to the bone. So the goals of rotator cuff surgery, really pain relief. It's an excellent operation, greater than 95% pain relief. Also improved shoulder strength once you've recovered. And really another goal of rotator cuff surgery is to prevent tear progression. You know, fixing a tear when it's small is your best chance of fixing it. When these tears get bigger, they develop atrophy and you have poorer tissue quality that occurs with time, it becomes more difficult to fix, if not impossible. So rehab after surgery, folks are typically immobilized in a sling for 6 weeks. We limit their lifting for 3 months and therapy for usually at least 3 months after surgery.